Hello, everyone, and welcome to this session of the AI Nurses Network webinar series. We have a wonderful nursing colleague, Dr. Hanna von Gerich, based at the University of Eastland, Finland, with us today, and she's going to talk about using machine learning in health economic evaluation. Over to you,
Yes.
Hanna.
Yes, thank you. Thank you for the introduction and for the opportunity to present this study to a larger nursing community. So today I'm going to be talking about the economic evaluation of artificial intelligence, or AI, in healthcare, with a special focus on a recent scoping review on the economic aspects of machine learning applications in healthcare. So the study in question, it's open access and available in International Journal of Medical Informatics. And the research team includes myself, Mikael Helenius, Iris Hörhammer-Hansmoen, and Laura-Maria Peltonen. So before we get to the good stuff, a few words on why we thought it is important to discuss the topic of economic evaluation in the context of AI and machine learning, and why we thought the world needs a review on it. So AI is typically framed as a solution for the rapid growth of healthcare expenditures and the global decrease of nursing workforce, and it is expected that it decreases healthcare costs while enhancing care outcomes. But we don't really have any hard evidence to support these ideas. By now, I think we are all aware that the amount of research of applying and developing AI for nursing and healthcare, and it has exploded during this century, and it's still exponentially growing. And this increase has also led to an increase of different frameworks that guide AI implementation and evaluation. But the majority of the frameworks, they focus on very early development stages, despite the fact that clinicians frequently report issues related to issues like system adoption or usability in the clinical settings. So in the end of the spectrum. And the evaluation of AI at the moment is still largely focused on model performance, such as precision or accuracy. And we don't really have hard evidence related to their real clinical impacts, or how they support decision making or patient care, or what outcomes they have. And economic evaluation can enable the assessment and comparison of interventions based on their scalability, sustainability, and impact on population health. So our review was not the first one to examine how economic aspects of AI have been studied and reported in current research literature. And we actually found 5 different studies with different scopes that assessed the quality of these economic evaluations, or how they have been reported. And the evaluation was done against established guidelines like the NICE guidelines or CHEER's reporting guidelines. But all of the studies concluded 2 same things. First, compared to the huge amounts of studies in AI in healthcare, in general, the number of economic evaluation studies was alarmingly low. Secondly, all of the studies pointed out that there is a big need to improve the quality and transparency of economic evaluations of AI in healthcare. But what the gaps in this research were, many of these studies included technologies that were not yet in clinical use. So they were not able to conduct the evaluations using real clinical evidence. So it was mostly theoretical evaluations. And the second gap, we found out that the complexities related to specifically AI technologies were not included in the quality or reporting appraisal guidelines used in these review studies. So what we did, our aim of this review was to map and synthesize current approaches of evaluating economic aspects of machine learning-based technologies implemented in healthcare, with the study questions: which technologies used by healthcare professionals and users have been evaluated for economic aspects in healthcare, which evaluation methods have been used, and how do the studies evaluate and present the economic aspects of implementing machine learning-based technologies in healthcare. And we chose to evaluate machine learning because artificial intelligence itself, it's a very broad term, and depending on how it's framed, it can contain a wide variety of techniques that range from like very, very simple rule-based systems to very complex deep learning models or large language models. So our interest was in these more complex solutions, and therefore we thought that focusing on machine learning based technologies would be a good solution. Just a few words on the methodology. We followed the Joanne Briggs Institute guidance for scoping reviews, including steps for setting the review questions and inclusion criteria, forming the search strategy, conducting evidence screening and selection, followed by data extraction and data analysis. What I want to bring out here is for the study inclusions, we adopted a very broad approach on economic evaluation methods. So they included both direct and indirect costs and also complete or partial evaluations. We also included all healthcare settings and professionals, but what we did limit was the included technologies based on their maturity level. So we wanted to only look at those technologies that were in real clinical use. And what did we find? We searched 6 databases and we identified over 6,000 titles, of which 128 were screened for full texts. I think it should be noted that almost half of the studies included technologies that were not implemented into practice, and more than 30 of these studies did not include a decent description of the technologies, which means that we could not define if they did even utilize AI or if they utilized machine learning. So in the end, we included 18 studies altogether. Just a few words on the characteristics. Although all of the studies included economic evaluations, it was the main aim of the study in only half of the studies. And they were predominantly prospective studies in outpatient settings, and they studied healthcare users. Most of the studies did not state using any guidelines when reporting the study findings. The evaluated technologies were mostly to support diagnostics and detection and used by clinicians, and more than half of them used images as data source. Almost half of the used machine learning methods were convolutional neural networks, but in more than half of the studies, it was not really defined what machine learning or deep learning method was used. Following this, most of the studies did reference the machine learning details in other studies, but we did not go and look at those definitions from the other studies. So moving on to the economic evaluations. I'm sorry about the large table here, but we will be going through it with some detail now. So the most used economic evaluation method in these studies was cost-effectiveness analysis, which means that it compares the costs of 2 or more interventions with measurable and one-dimensional outcomes, such as intervention rates or cost outcomes related to personnel or clinical outcomes such as number of diagnoses or patient hospitalizations. But at this point, I must also say that we followed the categorization made by the authors, meaning that the considered economic evaluation methods, they might not be entirely in line with commonly accepted definition of those methods. This can be seen, for example, in here, this table by looking at the considered economic evaluation outcomes, where, for example, some of these studies considered multidimensional measures, although they described themselves as just cost-effectiveness analysis. 4 of the studies used cost minimization, which means that the outcomes of the compared interventions are assumed to be the same. So the focus is, or at least it should be, on the costs of the interventions. Cost utility analysis was also used in 4 studies, which compares cost against multidimensional outcomes. This means things like quality adjusted life years, or QALYs in this table, which means combining the length and quality of life into one single value. We also had 1 cost benefit analysis, which evaluates 2 or more alternatives where both costs and outcomes are valued in financial terms. And finally, we had 1 cost analysis, which is a partial economic evaluation method, meaning that it's not a comparative analysis. But in this case, despite the study describing itself as a cost analysis, it did not actually contain any cost elements, which is a bit strange. About the economic modeling methods, half of the studies use a variety of descriptive approaches without any formal modeling, and almost half of the studies used basic economic evaluation methods such as Markov modeling and decision trees, and 2 of the remaining studies were inferential statistics. So, as an integral part of the analysis, and I think this was the most interesting part, we compared the studies against the Cheers AI framework. And I have mentioned the Cheers AI framework in this study during the other reviews. It's called the Consolidated Health Economic Evaluation Reporting Standards 2022 Statement, which is a 28-item checklist, which is used to guide the reporting of health economic evaluations. And in 2024, based on the original Cheers checklist, the Cheers AI checklist was developed to ensure that details related to AI and its implications to the analysis would not be overlooked in reporting. So compared to the original checklist, 8 items were elaborated with AI-related nuances, such as in title and abstract, you have to mention artificial intelligence and so forth. And in this table, they are marked with this AI plus sign. And also 10 AI-specific items were added to the checklist, such as user autonomy or measurement of AI effect. And here in the checklist, they are marked with AI and running number from 1 to 10. Yeah, so as I said, we compared the studies to this checklist to see if and how the items were reported. And with blue, you can see how many studies reported all of the details sufficiently. So you can see that background and objectives were quite strong, but for example, in title, not so much. They didn't perhaps mention economic evaluation, which is actually makes sense as it was not the aim in half of the studies. For the AI plus items or the AI specific AI enhanced items, we mark with red when both the economic evaluation details and the AI implications were not reported. So there is some dark red there. The orange indicates that economic evaluation details were missing. For example, the health economic analysis plan was not mentioned or detailed in these articles, and none of the studies mentioned approaches of engagement with patients and others affected by the study, or the effect of the engagement with the patients. So these were overlooked completely. And lastly, pink, which is, I think it's quite predominant in this chart, it indicates that key details related to the AI nature of the interventions were missing. So if you look at the AI AI specific items, AI1, AI2, AI3, and so forth, you can see that they are quite pink. So they were predominantly missing. So overall, the reporting alignment with the chair's AI items was around 40%. The studies reported 60% of the economic evaluation details, but only 21% of the AI-specific reportings. So quite low, I think. So what did we learn from all of this? Echoing the other reviews, we also found that there are significant gaps in reporting of the economic evaluation details, and there is inconsistencies between the studies and the literature on economic evaluations. So the concepts they use are not perhaps used right. The gaps in reporting AI technologies and their implications to economic evaluations was even wider. Only a fifth was reported. And starting with the technology descriptions, where we could not identify the type of machine learning or deep learning used in the studies, which I think is a pretty huge gap because we don't really know what we are talking about. So I think, I think we should stop using these like ambiguous terms like AI or machine learning when we are referencing to specific technologies or methods, because we can't understand what we're dealing with or understand or even evaluate their implications to clinical practice if we don't know what we're talking about. And it's impossible to assess how reliable they are, how comparable they are, if the studies are replicable, if we don't, replicable, yeah. If we do not know what we are assessing, and we can't use this information to make informed decisions. And also, what I think is alarming, that when we don't take into account that we are actually looking at different AI technologies, we assume that these technologies are static or they are frozen, meaning that when we implement them, there's not going to be any change on their behavior. But this is not true when we are talking about AI, or should not be true at least, and because they might evolve in time, but also they might have impact on the healthcare professional behavior, which we should also look into. And they also have costs that may need to be accounted for in the future. For example, additional data for training or other costs. And I think some of these issues, they stem from lack of understanding. Perhaps we don't understand AI, or we don't understand how economic evaluations actually work, how they should be done properly. Perhaps we don't understand the entire healthcare domain and how it affects. These are all very complex issues, and I think it's not very realistic to think that one person or one domain would understand all of this, but we need like this dialogue between different stakeholders, and we need to increase like multidisciplinary collaboration that combines all this knowledge and skills to actually have good evaluation of these technologies. And I think we should start looking at technology development as whole. So we need to look at the whole life cycle from very early on. So we need to elevate the frameworks that we have now, and we need to incorporate considerations related to technology use and evaluation from their early development phases. So when the technology is still on the drawing board, we need to start thinking about the end at that point. So some key takeaways to the end. We need to integrate evaluation into AI projects. So we need to build this economic evaluation, safety evaluation, workflow evaluation into initiatives in very, very early stages. And especially for nurse informaticians or nurses, we need to center nursing relevant outcomes. So we need to think how to systematically capture impacts of on nursing workload, decision making, patient safety, care quality, etc. We need to start making costs visible. So we need to document and also estimate full life cycle costs, including training, system integration, maintenance, system updates, etc. We need to monitor their real world impacts. So we need to follow up these implementation studies and see what is their usability, unintended consequences, and things like these. And we also need to strengthen evaluation quality. So to promote consistent, transparent reporting and use of these frameworks, just like the Cheers AI that I presented here. And we need to translate between two disciplines. So we need to connect nursing practice with informatics, economics, AI development, and work together, not in silos. So that was that was my presentation today. Thank you.
That's great. Thanks, Hannah. It was really interesting because, yeah, economic evaluations isn't really my area. So it was great to see the Chery's AI checklist being used.
Yeah.
I've just got a couple of questions. I guess as a nurse, how did you become interested in AI and start doing research on it?
Well, I was actually very interested in technologies growing up. So I have always been playing with computers and like software, not just games, but I was very interested in how software works, and that was actually going to be my career path. And I did study informatics for a while, after which I became interested in nursing. So it is a bit other way around, but I did not consider combining nursing with technologies or computers or informatics. When I started to work, I needed like a totally different, like I wanted to do something more like with people and be close to them. But I don't know. It has always been there, the interest in technologies. So when I continued my studies after working a few years as a nurse, it was, I don't know, it was very natural for me to combine this idea of using AI in nursing. So
great. Yeah, it sounds similar to my background. There's a few of us out there. And I suppose, yeah, do you have any advice for nurses who want to learn a little bit more about AI and how to go about getting involved?
Maybe find your people. I think that has helped me a lot. I have found people who have similar interests than me and who have helped me get ahead. I think the other thing is, like, do not get disencouraged. The AI is very complex, as we can see here. Not all researchers even understand all different implications of AI. So yeah, so it's a very complex field to study. So, but I think might be comforting to know that it is complex for us all.
Yes.
It's not simple.
Sure, yeah, that's a good point. And just following on from that, I guess, AI is going to develop more and change as we move into the future. And do you have any suggestions for the kind of trends or applications of AI that nurses should be keeping an eye on?
I might be very boring, but I would like to see more applications of AI in clinical documentation, because we need to build good models that are trained with nursing data, but we don't have good nursing data. So in my opinion, like integrating these AI systems that might help us document better or structure the documentation better or things like that, it could actually have a good impact also on like this data quality, while elevating like the burden of documentation. So it would be a win-win situation. I would like to see more more like research and also like clinical actual. I'm sorry, my brain started working, but applications.
Sure. Yeah, I
Yeah.
agree. So yeah, in the UK, they're starting to roll out sort of AI scribing technologies in some of the hospitals where, yeah, they're trying to automate some of the documentation. But again, it really just depends on the quality of the data that's there. And I agree, we need to have lots more nursing data that's digital and easy to use, because otherwise it's going to make, yeah, the application of AI much more challenging. Well, that's great. Thank you so much for your presentation. It's really interesting to hear a totally different aspect of AI that not every nurse would be involved in. And yeah, we look forward to hearing more about your research in the future.
Yes, thank you. Thank you for having me.